Hello, Suzanne Conrad with Dawning Visions Hypnosis, here to speak to you about an issue that comes up a lot with my hypnosis clients, and that is the fact that many of their psychiatrists will not help them get off their medications even though they have terrible side effects or they are not working. Do you find yourself frustrated being in this situation, especially if you're a psychologist or a mental health counselor of some sort, where you don't have the ability to really help your patients do this? I had a client many years ago who was having neurological issues based on some of the psychiatric medications that she was on, and her psychiatrist would not help her come off these medications. She figured out how to do it on her own safely. She had done it before she met me, ever worked with me. And it was a very, very long process. There's something inherently wrong when a psychiatrist or psychiatric nurse will not listen to their patient's own experience while they are on medication. It's ridiculous. We need to listen, and we need to work with psychiatrists who are willing to understand that they can never know what a patient is going through physiologically when they're on these medications. These medications are harsh to the body. They have a lot of side effects. And we need to be sensitive to that fact. So what do? I'll tell you what you do. You help them find a psychiatrist that will help them do exactly that. That's what you do. Sometimes you can look online and you'll actually find, like I did, or a client of mine who went on Wellbutrin, which I did not want him to do. And there's actually a chart in terms of how to help anybody get off of any of the SSRI medications safely from Harvard University. So there are resources to help, but it's best for them to do it with a psychiatrist. We know this. That's what I would tell you to do. Respect your patient's wishes. They're not telling you for no reason that they want off the medication. I found a way to work with my clients without any medication, because medication doesn't work in a lot of cases and it does have a lot of side effects. And I do it with hypnosis and neurolinguistic programming. In fact, I'm really happy when my clients come to me and they're not on any medication, because then they can actually think critically and they have normal moods, like the drugs haven't taken away and flattened their moods. And we're able to actually get a lot of work done a lot easier. They're able to let go of their problems and move on with their lives, which is what everybody deserves in this life. Be able to have a fulfilling and contented life. So if you want to learn how to integrate hypnotism and neurolinguistic programming, NLP, into your practice, I offer a 2-day VIP program. 2 days. Right? You can do it on a Saturday and a Sunday, literally. And then I have a 12-month mentorship program where you can contact me through Messenger and let me know that you would like to have a call so that I can help you with your patients as situations come up and you need help. I'll tell you the right way to order what you do with them and go through the processes if you need to have a little bit of a tune-up on how to go about doing those appropriately. And I can tell you quite honestly, my trainees love this program. Why? Because they don't have to waste their time flying out to some place, listening to a bunch of questions being asked over and over again by all the students who don't pay attention in the class, learning a bunch of junk that you don't really need to know in order to get the results that I have with my clients. It's about a 97, 98% success rate, albeit I do choose the people that I work with, and I work really hard to screen out those who are not ready to do the work. And to tell you the honest truth, that is my mission in this life. I want all of you mental health professionals to learn how to integrate hypnotism and neurolinguistic programming, NLP, into your practices so you can get the same results for your patients that I do. If you're interested in learning about this program, you can go down below into the description box for my contact information and let me know that you're interested in learning more, and we'll set up that free video consultation call so you can. That's all I have for you for today. As always, I thank you for spending your time with me. Till next time. Bye bye, all.